Hi, something. Good to see you.
Good old Paul.
All right, great. Well, first of all, I want to thank all of you for taking a half an hour out of your life to learn a little bit more about health and how your body works, which is what these talks are on Tuesday night. In about a month, I think, we're going to do one for animals, and that'll be a real interesting talk. So tonight we're going to talk about health. And we have a healthcare system right now, and which primarily when people think of our healthcare system, what do they think of?
Medicine.
Drugs.
Yeah, our medical system, okay? And our medical system, they do a lot of good for people. I'm not here to criticize them. In fact, I'll list the things that I think they do really well. Okay, first of all, emergency medicine is really good. They can save your life. You know, you're banged up, you're broken up in an accident, a fall. They can do that for you. They can do reconstructive surgery. Okay, so in a whole wide variety of cases, they can do that. They can do some amazing diagnostic imaging. Okay, which is good. Okay, I make use of that. All right. If you've got an overwhelming infection and the germs or the bacteria that you're infected with is not antibiotic resistant and your immune system is working properly, they can really help you get rid of that infection. So they can do a lot of things for you. But I'm going to ask you a question tonight. I want you to think about this. What can't they do? What have they never been able to do? They never will be able to do it. And they've never done this, in my opinion, in any human being. What can't they do?
Cure disease.
I haven't done that very well, have they? Okay, that wasn't what I was thinking of. That's an interesting answer. Every time I ask a question, I get answers back that I never thought of before. That was good. There's something else.
Well, they're not into nutrition, for sure. I know that.
They're not very good with nutrition.
Surgeries
Yeah,
are not good.
yeah, they're not good with nutrition. But
They
what absolutely cannot they do for a human being? What don't they create? They don't, I'll just tell you.
Health, yeah.
Yes, yeah, God, I
What'd you
should
say?
give you a gift card for that. You
What'd
got
you
the
say?
right answer.
Mary, what'd you say? Health.
They cannot create healthy people,
Oh, no
okay?
kidding.
They can give you all kinds of drugs for all kinds of things. They can do all kinds of surgery on you. They can give you antibiotics, but they cannot make you healthy. They don't create healthy people, okay? Good job, Mary. Man, I know now why I have you here. At this talk, okay, so tell me this. What creates health in the human body? Come on in.
I would say plenty of sleep, proper nutrition,
Yeah.
drinking lots of water every day. You know,
Come over here. Yeah.
knowing
okay.
your
You're welcome.
knowing your body as far as your allergies, staying away from, let's say you're gluten intolerant or dairy intolerant or peanut intolerant. You know, staying away from things that cause infection.
Okay, so our diet.
Or diet.
Our diet.
It's a big one.
And then you said sleep.
Sleep is very important.
Very important. Yeah.
Very.
Yeah.
7-8 hours every night.
Yeah. Exercise. Exercise creates health.
Yep, yep,
Okay.
yep.
So diet,
Every day.
sleep, and exercise. What else creates health?
But the conventional medicine tells you to
Lack of
exercise
injury.
too. They tell you to eat right. They just don't go far enough, maybe.
That's right.
They tell you to eat right, but they don't know what that means.
They don't.
Yeah, that's,
You know, they don't.
that's
They
wide
tell you to
open.
exercise.
They tell you to exercise, but
They might
You know,
eat McDonald's, yeah.
you know they might say to exercise, but there's they don't do that very well either, as far as I'm concerned. But they definitely they tell you to eat right.
They say
Most
don't
physicians
smoke,
I know don't eat
drink.
right.
Yeah.
Okay,
Don't
so
smoke, don't drink. Yeah.
so yeah,
Alcohol.
they do tell you not to smoke. I admit that. Okay.
Yeah.
So what else creates health in the human body?
Good central nervous system.
Okay, yeah, that's what we're going to talk about tonight. Okay, we're going to
Yeah.
talk about the role of the central nervous system, the role of the nervous system in health. So, all of these things are helpful. Okay, in fact, anybody in here know people that got the flu since Christmas? I mean, I know, and I was talking with a friend of mine in Grand Island, and she and her husband both got the flu after Christmas. And they both got it bad. And she's talking to me on the phone, and she says, man, I can't figure out what I've done. I think I've done everything right. And she says, I did this. I asked her, how much sugar did you eat over Christmas?
There you go.
How much sugar did you eat over the holidays?
Sugar cookies,
And
yeah.
she stopped, and she goes,
Fudge.
yeah, well, I ate fudge continually
Yeah.
through the month of December. Well, and so did her
Duh.
husband, so
Yeah.
it's no wonder they're sick, okay?
Yeah.
So when somebody brings me that stuff, you know what I do with it?
Throw it
I
away.
wait till they leave, and I go gift it to a neighbor, I re-gift it. Hey, look what I just made for you,
Call in the dog. Here, boy, here, boy.
So I generally don't eat that stuff, okay? So when you eat too much sugar, it depresses your immune system, okay? That's the reason she got sick.
Don't scare
But
me.
we're going to talk today about the central nervous system, because this is something that nobody thinks about when it comes to health. This is really, really important. So, let's see, is this not working?
Oh,
Okay, it needs new battery. That's okay.
Oh.
We can do it like this.
that's not bad. We can fix that.
Or can we?
Or can we?
There we go. So,
Built-in safety pin.
in our bodies, we have this thing, what I call the safety pin. It's your own God-given care and rescue mechanism. It's your nervous system, okay? And so, this is your brain, this is your body, and these are loops of communication between your brain and your body. And this nervous system is incredibly important because it really determines how your body functions. And all primary care doctors who care for people with a primary intention to enhance and express life in an individual know this. So these are loops of communication that go from brain to body, body to brain, all right? Now, this law is not this is not a chiropractic opinion or philosophy, okay? This is a scientific fact of physiology. The body sends messages to the brain to let it know what it's experiencing. The brain compensates for that, analyzes that information, sends messages back to the body, telling it how to adapt. These are loops of communication, the efferent pathway and the afferent pathway. Now, the way you can remember those is effervescence kind of bubbles over from the brain to the body. So I think of it like that, effervescence down the brain, and then the afferent pathway goes back. This is really, really important because your body can adapt to lots of things. And the reason it can is because of this pathway right here. So here's another example of it. You have the brain sending messages to the spine, to all the organs. They send messages back to the brain. And it's this constant communication and adaptation. So is it anybody in here ever tried to fast?
Yes.
Like,
Ooh,
okay,
yeah.
okay. So how'd you do?
One chiropractor or naturopath told me I should fast for 40 days. I think I told you that. I
That's a
drink-
little extreme.
Drink water,
Tell a
but
patient
no,
that.
and I've done 3-day fasts.
Yeah, so
And
have I.
I felt more energized.
Yeah. So when you fast, for the people that have fasted, do you find that after a while your body adapts to that?
Mm-hmm.
Yeah, it does. Your body adapts to that. That's the brain-body communication. So the longest I've ever done is I've done a couple 7-day water-only fasts, and your body adapts to that. And if you fast a lot, your body can adapt to that. It's this brain-body communication where your body, you have no food in your stomach, and when you normally eat, your stomach sends that information to the brain adapts and turns down that hunger mechanism over time. So, and I've experienced that myself. That's an example of the brain, the central nervous system affecting the brain and the body. So, anybody who does not know this or respect this before administering a diagnosis is basically violating one of the fundamental laws of life, and that's that this pathway has to be understood and has to be free for the patient to be healthy. Now, how important is the nerve supply of the body? I'm going to show you 3 scenarios, okay? Bad scenario number 1, really bad scenario. This guy's in the guillotine, okay? So, what happens when somebody's head is severed?
Cuts off the blood supply.
Okay, that's not a trick question, okay?
Yeah, and the
They
nervous
die,
system.
right? They die, how fast do they die?
Quickly.
Like instantaneously, like
Now,
that fast. Now, why do they die that fast?
because of no
Essential nervous
blood
system
and
is cut
nervous
off.
system.
Yeah, you've got your brain produces electrical energy, which it gives to the body. When that electrical energy is cut off, you die instantly, okay? You cannot exist for 1 second without that energy from the brain to the body. That's why somebody that gets beheaded dies instantly, okay? Electrical supply is cut off. Okay, bad scenario number 2. Partial severing of the nerve supply from the brain to the body. Much, but not all of the nerve supply is cut off. Now, you remember Christopher Reeve?
Yep, Superman.
Really sad story, you know, and he got thrown off his horse and fractured his C2, drove his C2 into his spinal cord, and severed his spinal cord mostly, ended up in a wheelchair for the rest of his life. So this is a partial severing, not a complete severing. Now let's look at bad scenario number 3. Subluxations interfering with the nerve supply from the brain to the body. This is where chiropractic comes in. A subluxation can cut off 60% of the nerve flow to an organ or to a muscle. We're designed to correct that. So, you don't have a complete severing of the nerve supply. You don't have a partial severing of the spinal cord, but you have a loss of nerve supply, of partial nerve supply from the brain to the body, and so the body can't function properly. So, subluxation that causes pain will eventually destroy your spine if it's not corrected. And here we show, here's a good example of degenerative arthritis of the spine, degenerative disc with the loss of extra bone here growing to stabilize that joint. We see that all the time in practice. I try and prevent that with patients, and putting the proper curves in the spine will help that. So the origin of life is triggered by what happens in the central nervous system. The brain is constantly doing its best to make adaptations and observations to help the body maintain as much life as possible. There's no evidence that a healthy brain can create a sick body, okay? In fact, it's constantly trying to make your body healthy. It's taking those horrible chicken McNuggets that people eat that are 50% chemicals that have no nutritional value to the body. It's trying to take those and make them into something that the body can actually use. By the way, there was a story, this came out about 6 years ago. This girl in England, 16-year-old girl in England, collapsed. It was in very serious health. They rushed her to the emergency room, and they couldn't find anything wrong with her. Nothing wrong, okay? They said, this girl, we can't find, and they started talking to the mother, and they found out this girl, since she was 2 years old, had eaten nothing but chicken McNuggets. Nothing but chicken nuggets, okay? That's all she would eat.
And she didn't look malnourished.
And her body did its best to take that and make something out of it, but after a while it could no longer adapt, and she just collapsed. Now, I think she was saved. I don't think she died, but that's a very interesting observation. Now, even if you never exercise and you eat junk food, your body's going to try and adapt to create as much health as it can in that situation. And we see this all the time in this country. People that don't exercise, they eat junk food, and a lot of them look like the Walking Dead to me. You know, I mean, they're not looking very healthy. Body's doing its best to adapt, and he does this through the central nervous system. Now, the nervous system starts with 2 cells, And the first thing that's formed in the human being is the brain. Brain is the first thing that's formed. Brain extends this thing called the notochord right here, which turns into the spinal cord, and then becomes the central and the peripheral and autonomic nervous system. So the very first thing that's formed in a human being is a brain and the spinal cord, the central nervous system. Why? Because it's the most important system in the body. Now, the body tries to protect things appropriately. So, did you know that bone, by weight, bone is 9 times stronger than steel by weight? Pretty interesting. So, the bone, the body protects the central nervous system with its own bony covering and the vital organs with ribs. Do you think it's a coincidence that the brain and the spinal cord are encased in bone? Anybody? No coincidence. I think that was designed by God. Okay, He designed us that way. The most important system in the body is encased in bone. Now, subluxations, which is what cause this interference between the brain and the body, have been described in several different ways. Number one is dysfunctional movement of a joint irritating a nerve. That's one way they've been described. Some people have described it as an inflammatory process of ligaments and discs and other tissues surrounding the nerve that causes the nerve to dysfunction. Sometimes you can have an outright compression of a disc onto a nerve, which you can actually see on an X-ray and an MRI. Another description of it has been an when the tissue, when there's changes in the tone of the tissue, there's electromagnetic changes in that tissue, which can create inflammation and cause nerve interference. And this inflammatory response is really, really important because so many people walking around in our culture are inflamed. Okay, they've got inflammation crawling through their body. Okay, what's one of the things that causes inflammation? Sugar. Our diets. Yeah. Sugar's the answer to everything, right?
Gluten.
So yeah, sugar and subluxations, they both start with an S. Okay, so easy to remember. All right. Now the scientific evidence, and there's lots of scientific evidence out there regarding this, and I have an entire half-hour talk just on this, shows that people with this form of dysfunction and subluxations, when adjusted, do a lot better. Their function gets better, and I'll tell you about one of my patients here in a minute. This happened to, and they have a decrease in their health issues. Now, there's 3 ways to look at chiropractic. Number one is I don't believe in chiropractic. Anybody ever run into anybody like that? They just don't believe in chiropractic.
Yeah, my parents,
Yeah, like a lot of people.
Yeah.
Okay. So it's okay. They don't have to. I mean, they'll come around. Okay. Okay. So the second thing is chiropractic is only good for pain relief, like taking an aspirin. Okay. So that would be the next step. Are there people that believe that way?
Yeah.
Sure there are.
Yeah.
I see them all the time.
Yeah.
Okay. Third thing, how about chiropractic enhances the way my entire body works, and thus the expression of life and organ function. This is the highest way. This is really what chiropractic is all about. In fact, chiropractic is not designed to make you instantaneously feel better. It's designed to make you instantaneously heal better. There's a difference between the two, okay? So, if you study the loops between the body and the brain, let me ask you a question. Do you think it's important that our liver gets 100% nerve energy so it can detoxify properly?
Yes.
Yeah. So you could lose quite a bit of your liver function before you knew there was ever a problem. And I see that all the time. I see people come in with blood work, lab work. I look at that, their liver enzymes are sky high. They don't know. Cholesterol sky high, they don't know. Sometimes your sugar's sky high, they don't know. They've lost a lot of function and they don't even realize it. Okay, because symptoms are the last stages of disease. Not the first stages, the last. First things to go, last things on the scene. Do you think a heart requires 100% nerve function? Yeah, absolutely it does, okay? Heart's the most innervated organ in the body. It is incredibly well innervated. So, Keith Wassung, he's one that does the slides that I show up here that when you're in the waiting room. He says, he stated thinking of chiropractic as only pain relief is like robbing a bank and stealing only the pens. Okay? So, I want to tell you real quick about a patient of mine. She's not here tonight, that's why I'm going to talk about her. Okay? I'm not going to tell you her name, okay? So, she came into me, I think it was the first part of December. I'd seen her before, but I hadn't seen her for a long time. She had this radiating pain down her arm, and her arm was just weak and painful, okay? And I had x-rays on her, so I knew what was going on with her neck and her back. But I hadn't seen her for quite a while, months and months and months and months, probably since way before last summer. So I evaluated her, adjusted her, and pain left almost immediately. I mean, it's and it stayed gone, okay? So she came back, the next pain was completely gone, arm was totally better, which, that's always nice. Patients like it, I like it. So I could have done a couple of things. I could have said, okay, your pain's gone, your arm's strong, you're done, okay? We're going to dismiss you, okay? I didn't do that. I kept seeing her in spite of the fact that her pain was gone. And it wasn't just because I liked her. It was because she had a very bad neck. So I kept working with her, and working with her. Her pain in her arm never came back. Arm strength never got weak again. But here's what she told me about, this is right before Christmas. She said, here's what I've noticed is happening to me. First of all, she said, I was losing my smell, and it's coming back now. Okay? I didn't know that. She never told me that. Now, I knew that she was losing her hearing, and she said, I feel something going on in my ear. She said, I don't have my hearing back yet, but I feel something's changing in there. The other thing that she says, my sinuses on one side of my head were constantly plugged. They're starting to normalize now. And the last thing she said, I noticed that I'm sitting up straighter, okay? Now, those are function issues. Those aren't pain issues. They're function issues. And what she was experiencing is what we see so often in chiropractic, is that all of a sudden things in the body start working over time as you work on somebody, okay? So her arm is what brought her in, and that was important, but now she's experiencing a lot of other issues regarding her health that weren't getting better any other way. So let's look at the way that medicine treats back pain. One of the ways they do it is they inject steroids into your back, okay? Now, steroids do a lot of things. They can decrease inflammation. They also suppress your adrenal function and do some other things to you. But I have a friend who works at the largest orthopedic clinic here in Lincoln, Nebraska Orthopedics. And here's what she's told me. She said, I see failed steroid injection after failed steroid injection after failed steroid injection at that office. She says, I see so many people where these things don't work, okay? So these shots they give people, and if they do work, they can decrease inflammation and pain. The problem is that now you don't even know you have a problem, so you go out and re-injure it even more. And then, so when they wear off, it gets worse again.
It comes back.
It's just a quick fix.
Yeah,
It
it does
comes
not
back.
fix the problem. So while chiropractic may be a little slower sometimes, it's much more in tune with what your body needs to be safe. And your body gives you pain for a reason, okay? Everybody agree with that pain is important, okay?
Yeah, body.
Your body
Pain is
to just cover up the pain is like if your oil light goes on in your car
Oil light's on.
and you spray paint over it and say, well, now I fixed that problem.
Yeah.
What's going to happen?
Comes back.
Yeah, pain's
The
going to
engine's
come
gonna
back. What's
fail.
going to happen to your car? The engine's going to blow up.
Yeah. It's gonna
The way I did that when I was a teenager, and it was not a happy day, okay?
No.
I learned
Dad
about that
was-
oil light
Dad
firsthand,
was
okay?
not very religious that day, I bet.
Yeah, you're right. That's right, I wasn't.
Yeah.
That's true. Okay, so what we want to do is research has proven that even a minor subluxation can shut down 60% of nerve flow. Only 10% of your nerves deal with pain. The other nerves support function, okay? That's what I want you to, so what does that mean? What does this mean? What is the implications there? Who knows?
You can lose a lot of nerve flow before you start feeling pain.
Yeah, you can have no pain and enormous loss of function and not even know it, okay? Not even realize it. So pain is not a good indicator of how healthy you are. I mean, I'm not saying pain isn't important. I'm not saying that at all. But it's not an indicator of how well your body's functioning, okay? There's other things that can go on and you not even know it. How many people have heard of people that get up and they have a heart attack and they didn't even know they had a heart problem? Okay, it happens all the time, okay? How many people have known people have gone to a doctor and a medical doctor got an exam and they found 4-stage cancer. Didn't even know they had it. They had no pain, no symptoms, okay? Pain and symptoms are not necessarily an indicator of health, okay? So you can lose a lot of function and not even know it, all right? So let's look at kids real quick, and then we're going to end it here. Kids can have subluxations too, and they may not necessarily feel any pain, but the consequences of kids having subluxations, chronic colds, allergies, food intolerances, behavioral issues, ear infections, sore throats, these are all, I see this type of thing in kids all the time. It stems from the brain-body interference. Now, I don't have to do nearly as much work on kids as I do an adult. They tend to respond a lot faster because they aren't as beat up as we are. But kids get subluxations too in lots of different ways. And so that's the last thing that I'm going to cover tonight in this talk. And, you know, most of you in here know of people who probably, you know people who are sick, who are not getting well, who have all kinds of health issues. They've been everywhere. They've taken every drug, had every procedure, and they're not getting well. You know, this may be the problem here. It may be a nervous system issue that's causing that. And, you know, we can help those people. And so my challenge to you is, you know, we will give those people a complimentary subluxation evaluation if they want to come in here. We'll look at them, we'll look at their posture, leg length, range of motion of their neck, and if they're a good fit for our office, you know, we may be able to help those people, and we will do that at our expense, that subluxation check. And so, you know, most of you, probably all of you know people like that. I know them. And call our office, send them in. Carmen will schedule them. We'll schedule them for a 15-minute subluxation check. We'll do a consultation, a subluxation check at our expense, and say, look, this is what we're finding. This is what we need to do. Or if they're not a good fit for our office, we'll tell them that. And I've had people come in that I've said, I don't think you're a good fit for us. You know, and have recommended some other place. But most of the time, people are suffering from nervous system interference, and that's why they just can't get better. So with that, I'm done, okay?